Good afternoon, everybody. It's Dr. Galvin with a brief coronavirus update. Lots of other things going on that have probably got people's minds off of the virus. However, we are really in a sticky time right now. We've had 21 million cases in the U.S. since it started. Numbers are up about 250,000 yesterday. We set a record of hospitalizations yesterday, 132,000. We set a record in deaths over 3,700 deaths yesterday. We've had a total of 352,000 people die. In my state of North Carolina, we had 10,000 new cases yesterday, and we have 3,960 people in the state hospitalized for COVID, which is a record. And we've actually set a record for number of admitted patients every day since about December 12th. Just to give you some context, on the 7th of November, we set a record and it was 1,100, and today it's nearly 4,000. So we are, there's good news on the horizon, right? We've got this vaccine, but there's been a lot of discussion about the vaccine. A lot of people say there's no way I'm going to get it. There are these side effects and things like that. Well, let's talk a little bit about the vaccine. Remember, I had it on the 24th. I got a little bit of a sore arm. That's it. I'm due for my second dose on the 18th. And what do I expect when I get the second dose? I expect to get some side effects on the second dose, because things like soreness, body aches, fevers, chills, maybe a little bit of headache, some joint pain, fatigue, those are not caused by the vaccine. They're caused by your immune response. So if you get those things, that's actually a really good sign. It tells you that your body is producing, the mRNA vaccines are telling your body to build these foreign proteins. That fever and body aches and things like that, that's your body's natural immune response going to destroy those proteins. Now, the way immunizations and immunology works is that the first time you get exposed to something, the response is relatively muted. So that first dose, you get a little bit of soreness in the arm or whatever else. Or if you get, if you are allergic to a food, the first time you eat it, you might get some very mild symptoms. But that initial exposure to that foreign material primes the immune system. And the immune system kind of learns that, oh, this is a foreign protein, it's bad. It develops these memory B cells that remember. And then when you subsequently get exposed, oftentimes it's a much bigger reaction because the body's kind of primed, it learned about it, now it's ready for it. And that's why people oftentimes have a much more severe allergic reaction to a food or to a bee sting or something like that the second time they get it than the first time because of that immune response. The same thing with vaccinations. If you develop body aches or fevers or things like that after the first one, that's your body responding. Many of us, when we get the second one, are likely to see that. So you'll start to see those reports. Again, that's not a side effect of the vaccine. That is a side effect of your immune response. And honestly, if I get that, I'm going to be pretty happy because I understand that my body has responded effectively to that allergen. Now, we've heard cases of people, they got the immunization and they caught COVID 2 days later. Well, yeah, it takes, when you get that first dose, right? That first dose we think gives you about a 50% reduction in risk. And it takes a week, 10 days, maybe 14 days for you to develop the antibody. So if I got exposed to COVID today and I got immunized tomorrow, I would develop COVID because that vaccine hasn't had time to work yet. So those cases of being reported, people getting it, that's likely what happened. You can't catch COVID from the vaccine because the vaccine does not have the whole virus in it. It's just got a little tiny piece of the virus. So it's impossible for you to catch the virus from the vaccine. The Moderna CEO was on a conference call yesterday. They think that maybe the vaccine may last for over a year, maybe 2 years. And if that's the case, it's a really good thing. These new variants, the one that came out of South Africa and the one we talked about before from the UK, those are concerning. If you look at the graph of new cases in the UK, it stopped being a curve. Sometime in mid-December, it became a vertical straight line up. And the numbers over there are just incredibly crazy. We've, now I think as of today have detected the new variant in Connecticut, Texas, and Pennsylvania. I think it's been found in Florida and California, Colorado. It's here, folks, and if we don't get control over this virus, it's going to be everywhere, and we're going to see numbers like England. I have been working in the emergency department. I started my residency in 1998, so I've been taking care of patients in the emergency department for many, many years. And I don't typically get stressed out. I don't get nervous about going in, but I'm working Saturday, Sunday, and Monday night. And I'm thinking about it. I'm going, gosh, here we are. It's going to be 2 weeks after Christmas and New Year's. It's going to be insane. And I'm not anxious about it, but I'm like, this is going to suck. I'm not looking forward to what kind of chaos we're going to see in the emergency department over the next couple of weeks. Looking forward, is there hope out there? Yeah, because, just anticipate this. This is my prediction, that we are going to have a very bad 3-4 months. So between now and about April, anticipate that we're going to see massive numbers of cases, rising infections, rising deaths. Things are going to get bad before they get better. But the combination of immunizations going out, I think at this point, we've immunized 6 million people in the US and about 16 million worldwide. As more immunizations get done, and actually as these numbers go up, guess what? Every time one of those people gets COVID, they've got immunity, right? And so we're going to get closer and closer to that herd immunity level. Where that level is, somewhere between 70 and 90%. We don't really know for sure where it is for this particular virus. Typically, people say, traditionally about 70%, but some viruses it's lower, some viruses it's higher. We don't really know until we get there. But, the more people get immunized, the more people that end up getting it, then the available pool of vulnerable people goes down, and that's how you achieve herd immunity. I will post my normal post-ER shift updates. I'll do one probably Sunday morning, and depending on how exhausted I'm, probably Monday and Tuesday as well. In the meantime, everybody stay safe. I'm Dr. Galvin. Please follow us on Facebook, like me on Facebook, and subscribe to our YouTube channel. And everybody stay safe, wash your hands, wear your mask, take care of yourselves, take care of your families, take care of those around you. Good night.